The CDC now saying COVID could be just a few mutations away from evading the vaccines you and I and so many other Americans have. What would that mean?
Well, it would be we'd more or less be back to March 20th, March 2020, except that we would have a vaccine platform and could develop vaccine much more rapidly than even 10 months. But it would be very, very problematic. We'd have to go back into a pretty severe public health measures like a lockdown. We have alpha, beta, gamma, delta, lambda. This virus does mutate. And part of the point of the mutations is to see how to evade detection and resistance. And that's what evolution tells us is going to happen. So the best way to stop that is to get the world vaccinated and get this virus out of circulation.
And reminder, these vaccines are available. It's the people are choosing not to get them. Heidi, you're at a school in Maryland.
They're available and they're free.
Great point. Great point. Heidi, you're at a school in Maryland that issued a mask mandate before the CDC's new guidance. What are parents and students telling you there? Because it's not just kids under the age of 12 who aren't vaccinated. It's lots of high schoolers who are.
Yes, Steph, we may be on the cusp of some pretty epic political battles nationwide about a return to mask mandates. But here in Prince George's County, which was so devastated by COVID, this decision is about common sense. It's not about politics. I spoke earlier with the superintendent, and she said case numbers are going up by about 200% over the past couple of weeks. And even though they're doing really well here with about 50% of students above the age of 12 vaccinated, she said it was not a hard decision. Listen.
For our community in Prince George's County, we were the hardest hit in the state of Maryland. Our numbers were extremely high for positivity rate, and we did remain in a virtual learning environment longer than any other school district in the state of Maryland. What I want to do is make sure we don't go back to that, and the best way to do that is through vaccinations and wearing a mask.
The big question at this hour, Steph, is how are hundreds and thousands of other school officials like her nationwide going to deal with this mandate when you've got 8 states that have said that you cannot have a mandate for masks? They made that legislative language, Steph. You've got immunocompromised kids. You've got immunocompromised staff. How do you bring them back with states like that that have actually said you can't mandate masks? Steph?
But Dr. Emanuel, think about all of this. There is so much mixed messaging and confusion. How is your average American supposed to follow this new mask guidance? Do we need to be constantly refreshing a map? I don't do that when I'm sitting in a car getting ready to go to the grocery store.
So I would recommend 3 things. Get vaccinated. They're readily accessible at your CVS, Walgreens, Walmart, Costco. Get that and get it as soon as possible. Second, wear a mask when you're going indoors, shopping, when you're in a crowded place outdoors like a farmer's market or something. And get, third, a really good mask. They're cheap. They're readily available. Here's one. Make sure, I recommend N95, NIOSH approved. Put it on your face. Make sure the nose part fits. We're not asking you to wear them 8 hours a day or 10 hours a day. Wear them when you go indoors. Wear them when you're going to interact with people whose status you don't know. If you're just walking in a park or walking down the street and there aren't people around you, you don't need to wear a mask. That's the common sense approach. I do endorse the idea that students should get vaccinated if they're eligible and wear a mask. There are many students in a school who can't get a vaccine. They're too young. They're under 12. They are immunocompromised or have some other problem that you don't know about. Maybe they go home to a very elderly person who is immunocompromised themselves. 3 rules. Get a vaccine, wear a mask indoors when you're with other people who you don't know, and get a really good mask, an N95 NIOSH approved mask.
Jeff, the president is considering a vaccine mandate for federal workers. I got to tell you, I assumed it was already in place. Why hasn't it been?
Yeah, it's a good question, Steph. And what's under discussion is a vaccine mandate similar to what's being implemented in California and New York City, whereby employees, in this case federal employees, would have to either attest to their vaccination status or submit to regular testing and other sort of mitigation measures. Now, this announcement is expected to come tomorrow in a speech where the president will also lay out other efforts and incentives to spur the rates of vaccination as this Delta variant spreads. And this, of course, comes just a couple days after the Department of Veterans Affairs became the first federal agency to mandate that employees, frontline health workers, get the vaccine over the next couple of months. I'm told the president, even though he has the authority to mandate that military service members get the vaccine, he's not taking that step just yet. The Department of Defense will come up with their own rules for that. But this is really a powerful signal about the degrees to which mandates are needed to spur vaccination rates, given the numbers of still vaccine hesitant people here in this country, Steph.
Okay, how about even getting more powerful, Dr. Emanuel? We said in the beginning there were always going to be anti-vaxxers, but there's a whole lot of people who are just hesitant. And if they wanted to get back to their normal lives, they would need to get vaccinated. We're seeing these mandates in France. They're mandating health passes for dining and travel. Yes, some people protested it, but as a result of these mandates, they're seeing a record number of people show up for a vaccine. 880,000 got a shot in a single day. 2 million signed up to get one. Why don't we do these? Require health passes here. You want to go to a bar? You want to go to the movies? You want to go to work? Get vaccinated or stay home.
Well, Stephanie, I think we are on the cusp of that. I think these increasing mandates, we called for all healthcare workers to be mandated to get a vaccine, and there's been a positive response from the health community. We're seeing it with municipalities. I know that there are a lot of cities like Fairfax, Virginia, that are going to require their municipal employees. I think this is sweeping the country, and I think we will have that situation where you are going to need a vaccine to do a lot of things. I think the two probably most effective or three most effective things we could do is require the military. The last thing we want is our soldiers or airmen or naval forces not being able to be mobilized because they have COVID. So I think military is one. Second is you want to fly, you want to sit on an airplane very crowded with other people, you got to be vaccinated. Americans have shown they really want to travel. Well, that's something that would be very effective to do. You want to get on a plane, you want to get on a train, you got to show that you're vaccinated. I think it's coming in this country. I've been an advocate of the mandate for months now, and I think it's almost inevitable that it'll be the way we're going to get to 75% vaccinated, and therefore put the coronavirus really behind us.
Mayor Johnson, you reinstated a mask mandate in your city 2 days ago. How is that going? Are people complying? And is there a penalty for those who don't?
Well, we recognize that we have to do what we must do to try to keep people safe. Fortunately, the CDC guidance helped bear us out in terms of following the science. We know that masks are a temporary, less intrusive way for us to get to where we need to be while we get people vaccinated. Here in Savannah, Chatham County, we're about 42% vaccinated, which is better than the state of Georgia's vaccination rate. We have to get people vaccinated. In terms of wearing the mask indoors, yes, we're prepared to be able to hold people accountable. We have to get through this. We have to get by this. And the fact is, we cannot afford, any of us, to go back to where we were in March and April and May of last year.
How do you hold them accountable? What's the punishment?
Well, last time we did the mask mandate, which was the first in the state, we held them accountable by fines. I think that since then, businesses recognize that if we move to shutting down of businesses, if we move toward capacity limits, if we move towards canceling of city events, everybody loses. So we're still working those sides out. I think that the general populace will help to move people into doing the right thing.
But Dr. Emanuel, can you understand the pushback from vaccinated people who say, I followed the rules. I wore the N95 mask. I got the vaccine. Why should I have to do this? The current pandemic is a pandemic by choice. It is among the unvaccinated.
Well, two things. First of all, we do recognize from this Delta variant that there are breakthrough infections. In other words, if you're vaccinated, you could have an infection. And that infection, while it may be mild, still carries risks. And I think you want to protect yourself maximally. The second is we have to stop with this notion that wearing a mask indoors for a few minutes is onerous or really problematic. And I think we have to just hang together. It's important not to spread anything if you by chance have a Delta variant and you're asymptomatic. It's also important to protect yourself and your family. The last thing I would say is we know that mandates are effective. We've seen in healthcare facilities like Houston Methodist Hospital, like many long-term care facilities that have instituted mandates, that you can get over 95% of the workers vaccinated and close to 100% of the workers vaccinated. I think these things work for people who are hesitant, who find lots of reasons, it's inconvenient, they're worried about being sick the next day, helping them over by saying, listen, you've got to get a vaccine. We're going to give you the day after you get the vaccine off in case you have fever or fatigue or some other problem. And that, I think, would be a huge benefit to the country. Again, if we can get up to 75, 80% around the country, that will make a huge difference in driving the cases, driving the hospitalization rate, and driving, fortunately, the death rate down.